person and ingest his parasites into the blood, and from there it circulates into the bloodstream, which now gives rise to affect other part of the body and present with some common symptoms that people know. But it's important that people are clear about the symptoms, because most people have misconceptions. Some people come to you and say, doctor, because I have fever, I have malaria. No doubt that malaria presents with fever, but it's not the only thing, it's not only the situation that causes fever. So by way of the common clinical features that people can present, which include both the symptoms, what the patient tells the doctor, and the signs, what the doctor elicits from the patient. So the common one people usually know is, doctor, I have fever. Some say that they will have headaches. Some also have chills, which is more in young people or children. Some also present with having joint pains, muscle pains. Some also start having mild abdominal pain. Some can vomit. And when it gets in extreme cases, because malaria can have the uncomplicated case and the severe case. So it is, and these two different aspects of it have different management. So some also present with having end up having vomiting and diarrhea. And some also complain that they find it difficult to eat, because when people are vomiting often, they won't want to eat anything. So these are some of the common symptoms that people experience when they complain when they come to the hospital. But in the severe cases, in which the malaria gets to the brain, some people can become unconscious, become confused, and some can even end up having seizure, which are the severe forms of it. Some are so weak that they can't even stand up, which we call prostration. And some of them also, when the parasite also gets to the chest, that's the lymphatic system, they can have chest pain. While also when the parasite in the blood gets to other part of the body, the liver, the intestine, even the kidneys, some people start having urine that is with blood, which is a part of the severe cases that they can have. So some people even get them having anemia because their the blood level becomes reduced. And this actually is even seen more in younger children, the neonates and the under 5 children. So these are the various severe cases that people can have. Actually, when somebody comes with symptoms, the doctor, based on the history the person complains, the doctor finds out other signs from the patient, and then now move on to do some investigations. What we have to do, some blood tests that can be done. Yes, there are many labs around, so people can decide to use the rapid diagnostic kits, in which they just take a little drop of your blood and place on a small machine which reads. But that is not actually 100% diagnostic, because it can still read negative, but the person can still have malaria symptoms. Yeah, there are other tests we do in the main lab, which they do a thick and thin film, which they look at the microscope to look at the malaria parasite. Then that's which will show you if there's the presence of the parasite in the blood. Then for those that actually get down with some complications, we do other tests for them, in which we end up sometimes doing the pack cell volume or the hemoglobin concentration to know the level of the patient's blood. In severe cases also, tend to look at the patient's kidney function tests. If some of them, because of the frequent vomiting and stooling, they can have derangements in their body electrolytes, which the electrolyte urea creatinine can elicit. So that's part of the common symptoms that people can do to elicit that. And there is those tests. When those tests is done, usually the malaria parasite tests, the result can be 1 plus, can be 2 plus. Some people can even get 3 pluses. And most times when you start getting 3 pluses, some people are already manifesting some of the severe symptoms. So with getting those results, it's important that when somebody have developed these symptoms and have the laboratory confirmation that treatment should be started. Because though malaria is something that is common here, it's also fatal that it can cause death, which is more in the infants and also affects severely those that are pregnant. So the treatment actually depends on if the malaria is a non-complicated, if it's based on, if it's a malaria that has complication, we call it acute uncomplicated malaria or the severe malaria. So the one that is just without complication and the patient can tolerate orally, can start them on tablet medication. And the recommended tablets that WHO has affirmed that people should take is the artemisinin combination therapy, called ACT. These are two drugs combined to give you effective treatment of malaria. In the market, there are different malaria tablets which people can buy.
With the body accepting the malaria treatment?
No, just that because of some resistant strains, it has been known that quinine is a very potent drug actually, but it also has its own side effects. But in most resistant cases, some people after taking the normal ACT, they feel stiff that they are not better. When they take some quinine containing anti-malaria, they tend to clear the remaining malaria parasites in their body system.
So what exactly would you say causes the resistant strains in the body?
One thing is that, most times in our setting here, most people, when they start anti-malaria treatments, they just take only the second dose, and they see that they feel better. And most people just end up not taking their drugs again. They just abuse it. And next time you want to now take similar drugs, the body, that drug will not be much effective as it ought to be. And then some people also don't even take the drugs as recommended. If you ask you to take drugs, most of the drugs, some of them are morning and evening for like 3 days, most common anti-malaria drugs, except some of the quinine that you take maybe once a day for 3 days. There are some of malaria drugs that are hungry more because of the quinine containing effect, which causes hypoglycemia. So people tend to eat well, and it can make you even more dizzy, more weak. But mind you, quinine is also bitter, so some people actually don't like that, but it's effective. But people should always take their medications. There are instances that people, because of the symptoms when they are vomiting and they are weak, we can start them actually on artemether injections. There are some other injections, EMA injections. And when they have finished that EMA, they're supposed to take tablets. The EMA or the artemether or the beta ether, different ones, it's not a complete malaria treatment. It's just a component, just one single component. And for any effective malaria treatment, it should be a combination therapy. So when people just take only their artemether, they think that they are okay. No. That injection have reduced the little loads of the malaria, but it has not completely cleared it off. So people tend to have even relapse. Maybe after like 3 days or more, they start feeling, they say, what happened? I thought I took malaria drugs, but they didn't take the complete treatment that they ought to take, and they have resistance.
Okay, there is also a saying that you are not to take vitamins when you are taking malaria treatments. Why exactly is that rule in place?
Yeah, that's a very interesting question because the public that are not aware of this, they think that because they are not, they lose appetite, so they need to take vitamins. No, that is not true. Vitamins, vitamin C, and other multivitamins. This is because those things works to reduce the effectiveness. Most of the vitamins are, I call it, they are antioxidants. They have to reduce the effectiveness of those anti-malaria drugs you are taking. So we advise that when taking malaria drugs, don't take those things. Finish your malaria drugs before. Most time when somebody is down with malaria, after taking the first dose, second dose, you see that your appetite might just start coming back small. And when you finish it, you can, if you think you cannot take it, you cannot take it, but don't take it together with those anti-malaria because it will reduce its effectiveness because it competes with the actions of those to slow its effectiveness. But then we talk about some of the severe cases which can happen. Some people can become having convulsion, some so weak, vomiting, and even anemic. So in those severe cases, we have recommended things that we do, we give people. The common one that people take with drip is quinine drip, but which must be given carefully under the supervision of a trained practitioner because of the side effects that people can come down with. So not anybody can just go and put quinine drip, no. It has some dangerous side effects. So people should be given by a trained personnel a bite. It's also called by a bite. And they also call the kind of mosquito that also gives that.
Okay.
Its symptoms is different from malaria symptoms, but some of the symptoms of malaria can also present.
Okay.
When some people some of them start having some itching, it reduces the load of the parasites, and then they cannot complete with the tablet, the oral medication. But since prefer to do not together with malaria, because today the cost of drugs and medications are actually on the high side. So all people have to do is to try to reduce the incidence of coming down with malaria. And this will also play a role in making policies that will help that ensure that people's breeding of this mosquito. And operation that people can do. People tend to use mosquito, let's call it pesticide treated nets that people can get, which is very good if the government can make it available much for even the less privileged to actually have that. That will help them to reduce their exposure to it. So people also get some repellent creams.
Okay, before you talk about the repellent creams, let me talk about the mosquito nets. I was going to ask that. We know on the first use, because I know that I've had that happen to me and it wasn't a funny feeling. And the more I tried to dip myself in cold water, the worse it got. So what exactly causes that burn? I mean, the net is supposed to be protecting us from the bites of mosquitoes, but it's biting us first before the mosquitoes get to us.
Yes, that is why when those insecticide-treated nets, you are cautioned that you should at least put it outside the open air for 24 hours. Because that net is treated with some chemicals.
Okay.
Which, if a mosquito, but if a human being uses it, even with your hand, touching with your hands, and mistakenly touch around your skin, you start feeling that peppery sensation. That is why it's important that it is actually sun at least for 24 hours. Because also the rashness of those chemicals reach out to the less privileged much more, so they can actually have access to that. Because malaria affects so much. Children, young children, those that are pregnant are highly affected, and it can actually cause death to them when they are not treated well. So that's a part of it. And part of more on the prevention, which I was talking about. Some people also wear long sleeve clothes that covers their hands. Even when this is running so slow, you went out and the person opened up the quinine by force. What should last over 4 hours, you finish within 1 hour. You should start having some ear discomfort. And they now say, doctor, I can't hear well because they rush that. Some even start, even collapse because they become hypoglycemia. So when doctors are giving, take it as when it should and allow it the course to go as directed.
Okay, speaking on this medical and medicine time frame as to administering, can you educate us more on the 8 hours drug taking when you're taking malaria drugs? Because I know that I've made a similar mistake before.
Okay.
I was given the malaria drug, it was accompanied with one other drug,
Okay.
I think, because I was telling her that I'm usually resistant to most drugs, so
Okay.
I don't remember the names. And so she gave me one other drug attached to it that this would help aid better flow of the suffering from the symptoms of the illness, where
Yes.
they lose appetite. So
Thank
how are they supposed to effectively eat to take this medication when it seems like you can't keep anything you eat in your system? You keep bringing it back out, maybe puking, or you don't just have the appetite at all to even eat the food.
Yeah. That's why I said in some instances, those that are very weak of vomiting, instead of giving the tablet, we can start you on injection. We can actually give you injection for 3 days, just once a day, or give you a start dose, depending on how you are feeling. By that injection, it have reduced. People have so many misconceptions.
Okay.
That is why this is very important, because everybody will tell you, say, I'm taking malaria and typhoid. That is not true. That is a wrong statement.
Please help.
Malaria drugs, antibiotics, malaria and typhoid. You must understand that malaria is caused by a parasite. Typhoid people are treating is caused by a bacteria. Because here, people abuse a lot of antibiotics. Any small thing, fever, stomach pain, you think is typhoid. That is not true. Typhoid also has its own symptoms, which some also can also present like malaria. But most times, what people actually have is malaria.
I heard a rumor one time that the test that they carry out here in Nigeria for typhoid isn't actually the test for typhoid.
Thank you.
So what kind of test for typhoid do they do?
All right, because of our environment and because of costs per se, though the common thing people do here is wider, but wider is not hundreds, it's not even up to 98% sensitive and specific for typhoid. That's for the Salmonella typhi that causes typhoid.
Okay.
Because other things can raise your wider value. Ideally, if you must use the wider test, it must be serial wide.
Ideal test for typhoid, and maybe they're experiencing all of these symptoms at a time and it's overwhelming. Is there anything that can be done to
clarify you, the stool culture itself takes maximum 2 days.
Okay.
It's a culture test, 2 days, it should be out. So if the person is on malaria drugs and yes, you're almost getting malaria drugs while you have already taken your stool sample, before you even finish the malaria treatment, the stool culture should have been out. You now identify if the bacteria is present in your stool, and they can now start you on the right, because most people have abused antibiotics. Sometimes when you now do the culture, the normal drugs people just go and buy drugs, and you think you have taken the drugs, and the typhoid, if it's actually there, is there because the drugs you are taking is not the one that is effective to handle it.
So is it medically advised to treat malaria and typhoid at the same time, or you have to wait one after the other?
It is it's not right. It's against medical practice because of the problems that we experience of antibiotics resistance. Treat the malaria, do a test, do a proper test, and if you isolate the bacteria that causes typhoid, then they give you the right antibiotics for it. Malaria is anti-malaria, typhoid is antibiotics. These are two different mechanisms of combating the sickness.
Wow.
So people need to understand this. That pharmacists and some chemists, they just want to say, they just give you and you just take. No.
Well,
to end with that, because why people confuse, because when you are down with malaria, your immune system is actually depressed.
Okay.
So your body can actually be prone to have they are affected with other kinds of infections around because of the depressed immune system. Some people start malaria, it starts sneezing, some start coughing. Yes.
So it's not the malaria that causes you to sneeze and cough?
The malaria can continue because it actually weakens your immune system.
Okay.
And in somebody else that is actually having similar, because of your reduced immune system, in some cases, when the parasites, because the parasite can also get to the respiratory system of the body,
Okay.
which if it becomes so more dear, it also affects that I can also present with some respiratory symptoms. Okay. It happens. I've seen a child just come, doctor, I have just chest pain. A student from school. I look at this everything, not much fever. I said,
from the line across the ocean to the land beyond the mountains.
Welcome back. If you are just joining us, this is ATN Health Forum, and today we have with us a doctor, Dr. Tochukwu. Now we'll be going right into the second segment of the show, Doctor and Me, and we will be listing a number of symptoms, and Dr. Tochukwu will tell us what could be the cause of those symptoms. Dr. Tochukwu, if an individual is experiencing trouble speaking and understanding what others are saying, numbness, weakness or paralysis in the face, arm or leg, problems seeing in one or both eyes, headache,
and these symptoms that are just listed here are actually symptoms that have to do with things happening from the brain itself, which we call the central nervous system. Yeah, and this could be caused by several conditions affecting the brain.
Okay.
But trouble speaking, weakness. We start from the common thing that is common in environments. So the most common thing that people might just say it is what we call CVA, which is called stroke.
Okay.
That's one of the common things that people might think of. But the other things also that can also present that. That's why when we come, we take a history, and when we now examine, we also now elicit other things that can be a differential to that. But when somebody has all these things, you have to find out if the person has some other underlying problem that have led to that. Because things don't just manifest. Something might have been happening within the person's body, which affect their eyes, even cause weakness. So there's something called space-occupying lesions some lesions that are in the brain. This, you can't actually see this until you do a brain CT scan or MRI to actually show you where these lesions are in the brain. So this is another thing that can actually present with some of these symptoms that people are presenting. Then in some of the also extreme cases, but which the person might not have all of this. Some people know when they tend to age, I just need to debunk that notion. First, if people understand the mechanism of what causes stroke, they won't be just thinking in line with that. Because something could have caused the blood to be so simply, in the layman's term, you can say stroke is just a cerebral accident that happens. It's a vascular thing that happens in the brain. So it's not that somebody is, because somebody just went to be thrown to bits. If you actually check from history, the individual might have having elevated blood pressure
Okay.
before then, and the body will also be, so people, even weakness, and when you're feeling weakness, you want to go and bathe on you can actually slip and fall. It's not the bedroom issue, it's what is happening in the body, the elevated blood pressure that affects the brain with a cut off of blood supply to an area of the brain that causes that, not that because of the bedroom lifting of water. No, it's what is happening inside the body and affecting the brain that actually cause that. Are you getting me?
Yes.
Because when you start feeling dizzy and feeling weak, better somebody should come and assist you to do what you are doing.
From what it says, the research said, it said the pouring of water from the face, that, like how I put it, the coldness of the water, once you pour, it causes like a rush of blood up your body to the brain. So the speed at which the blood goes to the brain when you do that, it causes you to have a stroke, something like that. So
yeah, that's not the, we call it the pathogenesis that leads to a disease.
Okay.
That is not actually. No doubt that there is a high blood, call it high flow of blood, include what people call high blood pressure, which increases the cerebral blood vessels, becomes elevated. There are some things we measure, mean arterial pressure and the cerebral perfusion pressure, which a doctor trying to find out, to know the kind of the states or the state of the pressure of the brain cells when somebody has stroke, because that will also help us to intervene if you're going to give drugs to crash the stroke. Don't just because your blood level is high, you just start taking drugs immediately to crash it. No, we do some things based on your BP and some other things to calculate and know if the blood getting through your brain is adequate for the brain function at that time.
okay.
That myth is just what people just tend to believe, but in the real mechanism of what how stroke comes to play, it's not that is the blood itself. The already high blood hearts, pumps blood and everything, which circulates and then flows to the brain cells. When it becomes so high, it affects the regulation of the brain cells, and that's.
All right. Thank you very much
for understand that.
For clarifying that. We're just going to rush right into the last segment because of our time, which is Doctor Answers. We have a couple of questions for you, Dr. Tochukwu, and this is coming from Esther. Esther says, "Hello, Dr. Tochukwu. I always experience bloating when I eat. Is that normal?"
Yeah, thank you, Esther, for that question. Yes, it's not normal to say, but if you actually overfeed yourself, your stomach can become, you can have discomfort. But if it happens always, it's not normal. That's why there are some conditions from having normal things we call the gastric or esophageal reflux disease. Some people also have gastritis. Some people also tend to have peptic ulcer. All these are a spectrum of different conditions that people can actually have this bloating. It's because of the food itself you have eaten, not digesting well.
Okay.
Not going down, because when you eat food, the stomach itself becomes highly acidic beyond the normal balance pH level. It totally causes a discomfort, irritation around the stomach walls. And even the issue of digestive process that the stomach has, we have to do so that the food can also go down, will become ineffective. And you see the person's food not going down, and the person having indigestion, and from there bloating. And most times the body wants to relieve it by you trying to throw up or keep on vegging.
Okay. Thank you very much for that. We'll take one more question because of our time. This is from Udwak from Calabash. He says, "Hi, Dr. Tochukwu. My name is Udwak. Why is one breast always bigger than the other?"
Well, That is not always per se. That is why we always teach people on how to do self-breast examination, which every young lady, adolescent should know. Normally, if you start seeing difference